Somebody please help. My daughter is having an asthma attack. Yes, what seems to be the problem, ma'am? My daughter, I don't know what's going on with her. She's coughing up these pink stuff, and she won't gain any weight no matter how much I feed her. She barely uses the bathroom anymore, and this morning her daycare called me and said she was wheezing and could barely take a breath. Please help her. Are these symptoms a reoccurrence, miss, or is this all just happening today? Well, no. I gave birth to her about a year ago, and she's been in surgery at least 4 times. When she first came out, the doctors told me that she had a surplus of mucus around her lungs, so she had to stay in the NICU while they treated her. I was finally allowed to take her home after 3 weeks, but since then she's always had breathing problems and repeated lung infections. The hospital and surgeons just told me she had asthma, but no matter how many antibiotics they send me home with, she just won't get any better. Don't worry, miss. We'll take care of your daughter. But in the meantime, I'd like to run a few tests, if you don't mind. Yeah, of course.
2 hours later.
Miss Walker, your daughter is resting peacefully, but there are some things I have to discuss with you. Your daughter isn't asthmatic, Miss Walker. She isn't? Then what's wrong with her? Your daughter has a degenerative condition called cystic fibrosis. Cystic fibrosis? What is that? Cystic fibrosis is a fatal hereditary condition that affects the respiratory, digestive, and reproductive systems. The cells that create mucus, perspiration, and digestive secretions are affected by this illness. It causes these fluids to thicken and stick together. This is problematic because they clog tubes, ducts, and passages. Symptoms can include cough, repeated lung infections, and inability to gain weight. Fatal and hereditary? Is my child going to die? Did I cause this? I made sure to do everything right during my pregnancy. I took prenatal vitamins, and I always made sure I kept my electrolytes up. Miss Walker, in no way, shape, or form is this your fault, but genetically, you played a role. During a genetic test, we cheek swabbed your daughter, and we found 2 copies of a genetic mutation called CFTR. It seems to be that the father of your child carried this gene as well. My God, I haven't spoken to her father since I gave birth to her. I truly had no idea. That's fairly common, Miss Walker. Many people don't know they carry the mutation until they get tested for it. To be sure of her diagnosis, we also ran a sweat test and a pulmonary function test. The concentration of chloride in a sample of her collected sweat was 75 mmol, meaning a positive diagnosis. Normal concentrations are normally below 40. We then ran a test to measure both the capacity of her lungs and how well the air flows in and out of them. I had her breathe in this compact device, kind of like a breathalyzer. My medical team followed her PFT numbers closely to track how well her lungs are working, and they weren't that good, Miss Walker. Your daughter Harley's test received a 50%, which isn't very good. Normal percentage is about 80 or above. Is she going to be okay, doctor? I know this is all very hard to take in, miss, but with proper treatments such as airway cleaning procedures, also known as chest physical therapy, they can assist to ease mucus blockage and reduce infection and inflammation in the airways. These treatments release the heavy mucus in her lungs, making coughing it up easier. The mechanical device resembles a safety vest. I will also be prescribing her an antibiotic called tobramycin. It's an antibiotic called aminoglycoside. It acts as an inhibitor of bacterial growth. As long as Harley does her treatment regimens consistently, it is quite possible she'll make it to 30 years old. It's not much, but considering her current circumstance, it's a miracle she's still even alive right now. Thank you so much, doctor. I truly appreciate you for your help. Just doing my job, miss.